Dr. Ashish, he's the director, as you just saw, Tata Memorial Hospital in Sangrur and Mulanpur in Punjab. And we started working in Bikaner actually some 8 years back. And there is a cancer special which runs a train which runs from Punjab to Bikaner. Those are the incidences of cancer in Punjab. Dr. Gulia, what do you think? What could be the reasons specific to this rage which is there in cancer in Punjab?
First of all, I think I want to congratulate you and everyone involved recently to put up this great integrative conference. So congratulations to each and everyone, and not just the Sanjeevani, each and everyone who is here. Because it's only with the dialogue we can understand more, we can put more better things in society and can make a difference. So I sincerely hope that the mission taken by you reaches miles and it is really helpful. And you continue doing such efforts in the future as well. Coming to the question which you have asked me is why that cancer train was there and what's the reason for high incidences in Punjab. See, I'll put it very simply. Dr. Gopinath has already alluded to it earlier. We are changing, our world is changing. And to be honest, I'll simplify it for you. It's not that difficult to understand. If we see today in India, 1 out of 9 persons, so if we are 100 here, so you can understand, 9 people will definitely have or develop cancer in their lifetime. So 1 out of 9 persons in India will develop cancer in today's growth rate, what we have today. Currently, about 14 lakh new cancer patients are added to this pool, looking at our population. So we see about 100 patients per lakh. That is the new incidence which is coming, which is the ICMR data. We've also contributed to it, as Rubyji was telling that we take care of 2 hospitals. One is in New Chandigarh, which is near PGI, and another one is in Sangrur, which is about 140 kilometers from this institute. We run cancer registries, and these cancer registries have contributed to this data as well. So 14 lakh new patients are added every year in India to the cancer pool. If you see the distribution of these cancers across India, broadly you divide them into rural areas, semi-rural or semi-urban, how you pronounce it, and urban areas. And then I'll give you an analogy and look at it how it is in the Western world. In rural areas, the incidence is about 45 to 50 patients per 1 lakh of population. And if you look at the urban areas, it goes up to 135 to 140 people getting these cancer per 1 lakh population. And Indian average is about 95 to 100. So what is so different in these areas? Before I answer that, look at the Western world. In Europe and US, it's about 250 per lakh population. So clear cut, we know that urbanization, which is happening in India, causing increased incidence of cancer. Now, is that the only reason? I think affluence, what people have. So Punjab, if you visit, if you have gone there, when you travel even through the interiors of Punjab, every single village has the same facility, the same kind of food, the same kind of affluence available even in the interiors. So if you look at Punjab, if you look at Chandigarh, if you look at the Western Haryana, most of these areas are already developed. So that's why we see a relative increase in the incidence of cancer. But what we are forgetting is that you are looking at entire urbanized population. And if you compare that data, the data says that there is no difference, there is no real increase in cancer in Punjab, which was related to pesticides and other things. So we did that study and we proved that there is not a stark difference in Punjab. It is just the affluence and the urbanization of entire Punjab that has led to all this. Why urbanization causes all this? is all about our habits, what we eat. Along with that, as the urbanization happening, the way we deal with our life is different. Like Dr. Vani said, the breast cancer incidence is much higher in urban population because our sisters, our colleagues, wives, mothers, we understand that in urban population they need to work. They dedicated more time for their career. They have children having at a later age. Food habits are not very great. There are some additional habits of alcohol and smoking. Sitting work in the office leads to obesity. So all these factors which comes as a part of urbanization leads to increase in the cancer. So I put it in a way that rather than looking at more other factors, this is globally known and it is very apparent that in many cancers, the urbanization has caused upsurge. But please don't be very sad. There's a flip side of this as well. There are some cancers like what I treat. I'm a surgeon. I'm a bone, skin and muscle surgeon. It is not impacted by urbanization. So the rate of these sarcomas remains the same all across wherever we go. And the better side is, as we're talking about cervical cancer where the hygiene is the main cause. So in India, the incidence of cervical cancer in women is decreasing because earlier, हमारी माताएं बहनें जो रूरल एरियाज में हैं इन एरियाज में there were no facility to take bath in proper areas. They were taking baths in ponds and the rivers and the lakes. There was no sulabh shauchalayas. So everything is really contributing in a nice way so that our women, the main supporting person of the family gets her privacy. She gets proper hygiene, which leads to decrease in cervical cancer. So I think these are the factors, the environmental factors, which is changing the paradigm of cancers, which we have seen over the last decade or so.
Looks like affluence is something which we need to kind of manage properly, otherwise it may start working against us. Also, please tell us about this concept of TCIN. We've been reading a lot about. Would you like to talk about that? So it is some traditional complementary
integrated medicine.
Yeah. What exactly it is?
So as we are sitting here, and again, I will just go back to the example of Sanjeevani because we are in it and you all relate to it. When I was in TMH, we used to interact with Sanjeevani team, but I was a clinician, a surgeon, so the interaction was limited, and I was not aware of the entire spectrum. But as you see here today in the presentation, the entire spectrum, it is all the components which entails to a holistic cancer care. So we as surgeons, medical oncologists, radiation oncologists, we try to give the allopathic trend of the treatment, which is globally the standard of care and which has been proved by various trials with the evidence. But there are many things which we don't understand. The biggest example is what we discussed, the stress. So there are some tangential or apparent factors which we can actually see. Stress है, आपको gastritis होगा, आपको stomach cancer हो सकता है, But there are a lot of intangible things which we don't see, which we cannot correlate directly to the happening of the cancer. So we don't know. Even today also our understanding is not as great. We can't understand each and everything. We are still evolving, developing and trying to see what are the other factors. When we talk about integrative medicine, even in Tata Memorial now, we've started integrating Ayush, the Ayurveda, along with the allopathic treatment. So giving that example, we're starting a new center in Panvel, where we will be growing a lot of vanaspatis, and which already has some proof that it may not be able to cure the cancer, but it can help you to decrease the side effect of the toxic treatment which allopathy is giving. In turn, you will be able to complete your treatment with the specified dosages without the break and can help you to get a better outcome. So we're trying to do that. Similarly, in Punjab also, with Punjab government, we are trying to again create one more herbarium where we will be growing these vanaspatis, because the vanaspati which can grow in Sahyadris will be different from what we can grow in Himalayas. So we are trying to integrate that, and we have MOUs with the various agriculture universities there. Same way we did studies on yoga. I think Dr. Vani will explain more because she was a part of the team with Dr. Badwe, where we shown that with yoga, your immunity increases, your mental quotient of how you approach the disease, how you take the treatment, it becomes better, and the same treatment is taken in a better way. So there are multiple other factors which we don't understand today, but I think today we are in a very dynamic time where these things will slowly integrate, and maybe over the next 5, 7 to 10 years of the time, how we look at the treatment of a breast cancer or a sarcoma cancer, we will so how we treat it like a disease management group where we have a radiologist, pathologist, surgeon, medical. We will also be having an expert who will be an integrative medicine expert who will see how the psychological help can come, how the yoga can help, how the Ayurveda can be implemented into it, and we'll have a bigger and more holistic team to understand.
So beautiful, so beautiful.